Okay, and we are recording. And hi, good morning. I'm Philip Lee. I'm with the Seward County Community College Marketing and Public Relations Office. And today I am with Janae, Zachary, and Arlette Austin. How are you guys today?
Doing great.
Good, doing good. How
Good.
are you?
Good, thank you very much. And we were supposed to have a third individual with us, Judy Lathen. Unfortunately, she had a prior commitment, and maybe she'll join us later. But as right now, Arlette and Janae will tell her story as well.
Okay.
Okay. All right. What we're doing today is that we are talking to these two individuals, or actually three individuals from the college, who have actually gone to the front lines of the COVID pandemic and actually helped out. And I want to say that that's incredible. There is no way to show our appreciation for the people who actually volunteer to actually do that work and actually put themselves actually at rest, I think. So we just want to say, I'm sure I'm not just speaking for myself, but everyone over there that says, we think you guys are incredible. And you guys really, to a certain extent, you guys are heroes. You guys are first responders, and we're just so super proud of you. And I know that that's one of the things over here is that being at Seward County Community College, we just see you guys as faculty and people who have gone to basically away from the service and to go into academia, but yet your roots are in the service areas. So we just want to touch a little bit on that. But first of all, let me go ahead and Janae, why don't you tell us a little bit about yourself, and then I'll pass it on to Arlette and she can give us a little background on her.
Okay, so I'm the director for the respiratory therapy program, going on my 5th year now at Seward County Community College. And background, I honestly never thought I was going to end up being a respiratory therapist because I was diagnosed with asthma when I was a little kid. Had it pretty bad as a kid, but over time with medication and learning to manage it through immunotherapy, I've really kind of grown out of some of that needing to go to the hospital. But because of that, I didn't really want to make it my whole life. So I wasn't sure that respiratory was for me, but then I shadowed a respiratory therapist and felt I could really relate to the patients. And it was kind of, it was the people that I felt like I could help the most. I knew I wanted to be in healthcare. I just didn't know what field. So that kind of leads me to where I am now. I'm an alumni of this program. I did work at Southwest Medical Center for 8 years, and then I decided to come over here when one of my instructors was retiring. And then I've just stayed here over time as the other instructor, the director, retired, and then I moved into this position. So then we kind of recruited Arlette to come out of serving at the hospital as well to come help instruct the future respiratory therapist here. So I'll toss it over to Arlette.
So as Phil introduced me already, my name is Arlette Austin. I'm the RT Director of Clinical Education for the Respiratory Therapy Program. And I have been a therapist for 8 years. And prior to coming over here to work, I began my journey after graduating from Seward County Community College. I went off to Kansas City and was there for a while before moving back home. I worked here a few more years before being recruited over here to the respiratory therapy program alongside Janae. And a little bit of how this kind of started for me, actually my sister has asthma. So actually that kind of prompted me to want to help others that, were in the same boat as she was, because she's a pretty severe asthmatic, or was when she was younger. And I've always wanted to be in healthcare since I was in high school. I just didn't know exactly what career field, but I knew it had to be in healthcare somewhere, because I just really do truly enjoy helping others. And, I feel like that was where my heart and soul led me to, was just healthcare. And here I am now.
I think it's just absolutely amazing and just wonderful that you both are alumni of Seward County Community College and decided to come back and to sort of, almost to a certain extent, give back to your knowledge to the students out over there. And hopefully there'll be so many other students who will follow in your path, give, and then come back as well.
We hope so.
All right, so let's go ahead and talk a little bit about this summer. And you guys were both all for the summer, correct?
So we actually were on 11-month contracts. So we were both working. I'm off in June and she's off in July, but we were both working at both places at one point in time because we actually started in May and we're still contracted all the way throughout May. So we were working at both places.
Okay, so how did this all come about? And from what I was talking to Arlette, that this just sort of, you guys had talked about wanting to do it, but you guys sort of did it on your own, and you guys didn't know that you guys would end up working there, correct? Which you guys worked at Southwest Medical Center here in Liberal.
Yes. Yes.
And
so,
like I was telling,
yeah, go ahead.
Sorry. As I was telling Phil a little bit ago, I had no idea too that Judy was helping at Southwest Medical Center until I just happened to run into her when I was working myself up there. So we, like we said earlier, we didn't know that we were all there, but we just happened to, you know, all help out.
Yeah, I was just going to say, so what happened was, of course, we knew there was a respiratory pandemic with COVID-19, and Arlette and I had both kind of discussed it. You know, some of the hospitals that Arlette was talking to about our students that go to clinicals there, they were kind of like, hey, we need help, you know, we need ventilators. So we did donate our ventilators that we use in our lab here to Southwest Medical Center to use during the pandemic, because of course, everybody knew at first mechanical ventilators is the way we were treating it on pretty much everybody, because we weren't sure what we were dealing with. When it's an airborne type of disease or virus, we want to make sure and contain that so that it's not being spread around the room, and so that people that are caring for those patients aren't also getting sick. And so the best way we could do that is with a mechanical ventilator, which keeps their breath and air all within the machine and is filtered before it's put back out into the air. So we donated our mechanical ventilators to use during that time. And then, you know, of course, that everybody was kind of looking for help, and we decided what we should do is help serve our community that we help serve through Seward County Community College as well. And Arlette lives here and I live in Plains, but again, you know, our roots are here. So we wanted to help work here and serve our community, just like the values that we preach here at Seward County Community College, you know, that we want to have integrity and that we want to serve our community. So.
Arlette?
So I'll go ahead and get started on my experience with helping them. Well, first and foremost, I want to recognize all the therapists, all the respiratory therapists at Southwest Medical Center. I mean, they're truly angels. They pretty much took us under their wing, actually, and guided us to how they were, you know, treating these patients. And, you know, without them, you know, Liberal would be lost. So they are truly heroes. And then, you know, when I just first started, we had up to 9 to 10 ventilators at the time. All the patients were on ventilators. They were pretty critical. They were pretty sick. But thankfully, with all the therapies, it was just really trial and error because, again, this virus is still unknown to everybody. But at this point, the more we learn about it, the more upgraded treatment modalities we're striving to go towards that way. And like Janae said, at first, you know, it was all mechanical ventilators. That's all we kind of knew what to do. And then as time went on, we kind of knew how to treat them a little better, and with more research. And thankfully, you know, a lot of people get really frightened and think, you know, if I get this virus, I'm probably going to die. And the truth is that actually it's not that way. But I'll let Janae kind of go over that a little bit more. But whenever I started joining them, it was early May. It was pretty critical. All the ICU rooms were filled, and all the patients were really, really critical at that point. But again, it just progressively got better and better.
Definitely.
Let me just sort of follow up on that, and both of you to answer. Was there there a lot of apprehension going in? You know, just sort of like firefighters and first responders, you just sort of rush right in. But I'm sure, like as Arlette said, that, you know, there was a lot of fear over there about what this disease was and how do you deal with it? Would you get sick over there? I mean, was there any apprehension at all about actually volunteering and going in?
Actually, I'll be very honest, there really was. At least for my part, I'm very much apprehension on my part. It's just the fact that, you know, because this virus was so unknown, we didn't know. But again, wanting to help my community and help those in my community in the community that I was raised in, that overweighed being scared. I'd rather help those and put my life at risk than being scared. So that's kind of like what just wanting to help and serve is what overweighed my fear.
Okay, Janae?
Yeah, I would totally agree with what she said. I mean, I even talked to Arlette about it a few times because of my asthma and because I do still take medication every day and I'm still on immunotherapy with allergy shots and stuff like that for my asthma, that I was pretty scared to go back because, of course, they were saying anybody with any kind of respiratory history was at a higher risk for having more complications. So I was really scared. And of course, my mother was not happy that I was going back during this time. But like she said, really just wanting to serve the community and feeling like it was our obligation as healthcare providers and as part of serving this community as part of Seward County Community College faculty members, we just felt like it was what we needed to do. It was the right thing to do.
Now, just following up that, Janae, so I'm sure that the doctors out over there, like they said, like you were really, really at risk, but they really needed the help. And I guess that they were going to take whatever help that they could, correct?
Right. So really at first, and I think, you know, Arlette talked about her experience. She really went in, like I said earlier, than I did. I waited until I got done with our classes here, which I think is kind of what Arlette did. And then I was also taking classes towards my master's degree online through Fort Hays State. So I kind of waited until I had wrapped that up as well, because I had a big project due at the end. So I didn't get there to the end of May, so things had really calmed down. But the other therapists knew that I do have asthma, so they were really good about trying to keep me out of the COVID units at first. And then as, you know, time progressed, of course, I took my turn in doing that and working in those units. But really, I mean, it just comes down to everything they're promoting. It's taking care of yourself, putting on all of your protective equipment every single time, making sure you're putting it on the right way, taking it off the right way, doing your hand hygiene, wearing your mask. I mean, you just had to follow the rules as much as you possibly could, and you know, hope that you were doing all you could to protect yourself.
Let's sort of talk about the experiences actually seeing the people in there. I'm sure that, you know, again, being in these kind of first responder situations, that you see these people who are incredibly sick and, you know, struggling. What kind of experiences did you have, Arlette, with that? You sort of talked about that a little bit. What kind of emotions were you seeing, and how eventually did things sort of, you said things got better, so how did that all pan out?
Well, early May, when I first joined, it took two respiratory therapists, to just work the COVID ICU alone, just that unit itself, because there was that many patients that were that critically ill. So what we did is one therapist started on one side of the unit, and then I started on the other, and then we met in the middle and then went back. So we were just doing this constantly back and forth, overseeing each other and helping each other treat all the patients, because each patient was just very one-on-one, just because of the state that they were in. So by the time, I would say, by the time we actually started our rounds and actually were able to take even a slight of a break or even sit down, or, you know, because it was so extremely busy, it was probably 2 o'clock in the afternoon. So, and that's what, like I said, that's with two of us helping each other. That just kind of gives you an idea of how extremely busy it was there and how extremely critical some of these patients were, that they just needed our care around the clock. As far as experience with the patient, the most memorable one to me would be, he was very sick and needed intubated and placed on a mechanical ventilator, and he just wanted somebody to hold his hand and just tell him that everything was going to be okay, because, you know, his fear, he kept telling all of us, was at that point that he just didn't want to die. So with that said, that kind of just gives you an idea of the emotions and the fear and just everything mixed together. But again, as time progressed, it just got better and better and better. And good thing is that now as we speak, it's just, I mean, it's tremendously a 360 of what it was then. So that's reassuring to me that this is getting better.
Janae?
Yeah, so I'll just kind of go off of what she had said. I mean, that honestly, that makes me get teary-eyed, because I think the other thing too, and a lot of people know that had any family members that were in the hospital with COVID-19, there are no visitors allowed for those patients, because we're trying to keep as much PPE for the healthcare providers. Because as everybody knows, there's a shortage already. So having visitors come in and possibly contract it only, worsens the problem. So a lot of these people were really depending on the healthcare workers to like Arlette said, be there to hold their hand and tell them everything's going to be okay, because they can't have their family there. Really, all they could do was FaceTime or talk on the phone. And then once they go on the ventilator, of course, they're basically asleep. They're put into an induced coma so that we can take over the breathing for them and help fix their lungs so that we can wake them back up eventually. Mm-hmm. So, I mean, if you can only imagine not being able to be around your loved ones when you're really scared and you're sick, because I don't know about you, but still to this day, if I'm really sick, I'm calling my mom. So can you only imagine, being in the hospital and knowing you're going on a ventilator and you don't know if you're ever going to wake back up from that? It's pretty scary. But the other side we really wanted to promote too is that Southwest Medical Center, like she said, shout out to the RTs. We wanted to recognize them, but all of the employees, I mean, everybody there was really putting in effort to help our community, and all of them were at risk. Every single person that was in the hospital, because even though we do have COVID units, you can't ensure that it's really just contained in just those areas, right? Just touching something and forgetting not to wash exactly right and touching something else. I mean, everybody was at risk that was working there, and we were just amazed at how everybody just stepped up. But the other side was that while there was really critical patients, we wished and still wish that the media would promote more of how many of those people that got COVID-19 that are positive actually were hospitalized, and then of those, how many actually died. And so at Southwest Medical Center, and I think Arlette helped me out here, but we talked about it earlier, I think Dr. Ilyasov, which is the chief hospitalist there, I think he even published his data from this, but for our population size, to how many people we had become positive here, we actually had some of the most cases in Kansas. And then from that, of those that were hospitalized, I think, Arlette, you said it was a 0.2% death rate. That is very low. It's actually one of the lowest across the nation, is what Dr. Ilyasov was telling us. And so anyway, yeah, we want to recognize that Southwest Medical Center did an amazing job at taking care of our community and our surrounding areas. And, because people were sending patients here too, because some of the bigger hospitals didn't have any room anymore. There wasn't anywhere to send them. Mm-hmm. So you have to get them to the places that actually had the ventilators, which are, some of our larger hospitals like Liberal, Dodge, Garden. So anyway, as far as I think, like I said, the most memorable thing to me is just having to watch these people talk to their families via FaceTime while they're sick. I mean, that just breaks your heart, because you know that they're scared. And then sometimes too, having that language barrier, trying to find somebody that can tell the patient what's going on when I needed to put them on like a non-invasive ventilator, or I had to put them on a high flow cannula, something like she said, after we moved away from only mechanical ventilation, even putting them on something more than just oxygen in their nose really scares people. So trying to reassure those people that we definitely had language barriers was also difficult. But again, we just want to make sure the community knows, yes, it was serious. It is serious. It's a serious virus. It can affect some people very seriously, but most of the people, it really doesn't. There's only a small few that are hospitalized, and there's a very small few that have died. So we just wanted to make sure and kind of promote that and make sure we recognize Southwest Medical Center for their hard work too.
Right. I think that's important to really know about that symptom too, but I think you touched on that. It's really serious. And even though the fact is that, we've been lucky with and had great help with the death rate and the positive, there's still really, we have to take it seriously, because if we don't, I'm sure that you'll understand that those numbers could just fly off the chart if we don't take care of ourselves. I think that's like one of the things over at the college that you certainly know, is that, we're trying to be as safe as we can to prevent these from happening. And so if you do get it, we have a wonderful hospital staff and people like Arlette and Judy and Janae who will help us out with that. And I think that's important to know. Without a doubt too, one thing I wanted to ask you, you guys have been in situations again, being therapists in the hospital is always, crisis going on, they're always going to run into patients. But have you ever been in a situation that has actually been like this, a pandemic? And how has that sort of changed your perspective on things? And I'll ask Arlette first.
Okay.
What do you mean, Phil? Like, as far as like the perspective of like,
How does this change? You've seen, like, you've gone into the hospital before and you've seen patients on ventilators and such. But in this case, you have all these people out over there. I'm sure that this is the most of that you've ever seen before at one time. And it's something probably that you've never encountered before, because you've never encountered all this before here. And so how does that change? I'm like, maybe you see one or two or three, but here you've seen like, 15, 10 or whatever.
Well, first and foremost, that to me, it solidifies how much important respiratory therapists are in the healthcare community. I think this validates that, us as respiratory therapists are needed more than ever now. And I am very proud of the graduating class that, we had just had the virtual graduation ceremony for them. And then they are, going to be in that position soon to where they're going to be frontline heroes as well. And again, because now more than ever, we really are needed. This is a respiratory, or mainly respiratory virus and pandemic. So again, I mean, I'm very proud of everybody that has stepped up and helped out. And alongside with students, all of the allied health students here that have just graduated and that are fixing to go into the front lines. So.
Okay, Janae?
Yeah, so as far as like changing perspective, I think I guess I just feel like as a team at the hospital, even here at Southwest Medical Center in a smaller community, that we were able to take care of patients that in some places weren't able to survive, and we were able to help these patients get better. And I feel like, now I feel like our hospital can do just about anything, if we can make it together through this as a team and, and help cure some of these patients in a pandemic where, like we said, nobody really knew what to do for sure. I mean, even when I wasn't there yet, I was still sharing information that was just, flooding my email as a member of the American Association for Respiratory Care, which is a national group. Everybody was trying to share their best practices. There was even through one of our publishers of some of our books, they had even made a worldwide group that was sharing some of their best practices of what was working for them for these patients. So really just coming together as a team, as respiratory therapists all across the world, I mean, that just says a lot, that nobody was using ego or anything like that. All we wanted to do was help patients get up and make them better. And like I said, and even coming together as a team at the hospital and recognizing everybody's crucial role to helping get those patients better was amazing. I think everybody worked well together, and it just makes you feel like, you can trust almost any hospital now, that everybody's seeing that they're going to do whatever they can to help patients get better. And I think you could see that nationwide.
Mm-hmm. Does, following up on a little bit with what Arlette said, is that pretty much gives you a perspective for the students over there, that how much they need to be, they're needed,
Yeah.
and to sort of, drives you more to get students graduated.
Yeah, you're definitely right too. They were, for a while, they were even allowing students to start, they were trying to, what do I want to say, expedite the student licensure, because they were needing RTs that bad, that we've always had RT students that are allowed to work in the hospital, but they have to be under kind of like a preceptor mentorship kind of thing. But they were encouraging that even more because respiratory therapists were needed so much. So yeah, definitely as many graduates as we can put out there right now, we know that they're needed. And while some hospitals, I think some of their staff in some of the bigger cities are being laid off because they're not having a lot of outpatient stuff because of COVID. They don't want anybody extra in the hospital. So seeing them asking us for more people is kind of the opposite of what's happening to the other staff within the hospital. But I'm sure once things calm down, like Arlette and I said, as things start to kind of trend downward, we'll see all those people coming back and getting jobs again too. But it has like she said, it's just brought a bunch of attention to respiratory therapists to show, you know, that we do have a lot of knowledge and skills, which is great.
Now, there's a third person over here who, like we said before, who had a meeting today, but it was Judy Lathen, and she is actually a nursing instructor. So, and you had said that when we were off, that you had, that you knew a little bit about her story. So, Janae or Arlette, can you guys shed some light on that?
Well, I was just going to say, I mean, really, I just kind of ran into her at the hospital. Like we said, we didn't really talk about it with any of the other instructors because most of everybody, like he said, is off during the summer. So nobody else really knew that we were there until Arlette and I knew each other were going, but we didn't know Judy was there until we ran into her. I know she was a nurse for a lot of years between maybe, and I don't know if she worked at Meade, but I know she worked at Southwest Medical Center. So I'd worked with her before we worked together here teaching. So I know she's a skilled nurse. She's been there a long time. And then I think the few times that I ran into her, she was actually the charge nurse for the day. So that kind of means she's going around checking on all of the team, and anywhere anybody needs extra staff or extra help, she's there to help. If there's any kind of emergencies, she's there to give guidance and help them through that situation. If we need more staff, she's on the phone calling everybody. So that was the few times that I had seen her. She was there as the charge nurse. So she was really taking on a lot of stress and a lot of extra time and care there. So we definitely want to recognize her too, because like I said before, all employees helped this pandemic. Yes, respiratory therapists kind of got the light through this because we were running the mechanical ventilators and working, because it was a respiratory type of virus.
Right.
So we kind of got the light of it, but you know, it took a whole team to get these patients well. So we definitely want to recognize that too.
Yeah, I think that, you know, again, it's about everyone helping each other. And, you know, sometimes we sort of lose, we sort of lose the perspective of it that, well, it's just doctors or it's just, but it's really everybody. It's a team, like you said, Janae, that actually put it all together. Janae, is there anything that you would like to add?
Just, you know, like Arlette said, we're proud of our new graduates that we're putting out there. We feel like they're going to be very skilled healthcare providers. Arlette and I both bring a lot of experience. Both of us had worked in Kansas City before we actually moved back to the smaller communities to get that kind of critical care experience. And then now through this pandemic, I feel like all of us are skilled at it now, whether you've worked in a big hospital or small. We've, like you said, we've all been exposed now. To running the ventilators and dealing with really critically ill patients. So anyway, sorry, my phone's ringing. So anyway, I just, I just wanted to add, we're really proud of our new graduates that we put out there. We're excited for them to get out there and help. And that was pretty much all I had to say. My phone keeps going off, so I'm losing my train of thought. But yeah, we're just happy. We're happy to help in this pandemic. We're happy to be putting out graduates that we feel are going to be great healthcare providers. So that was mostly it for me.
Arlette?
I mean, she pretty much wrapped it all up. Like I said, I'm very proud of all the allied health students over here. And again, I really, really want to recognize Southwest Medical Center for the tremendous and a phenomenal job that they've done during this crisis.
Well, you know, not only just Level, but Seward County Community College is just really grateful and wonderful to have both of you, along with Judy and actually all the entire staff, to actually help out. And I think that, you know, you guys had mentioned the fair, but you guys really stepped up, and there's really no words to sort of say how you're willing to take the chance of giving your lives, really, I mean, putting yourselves up front to help the community. And I'm sure that it's something that you thought really, really hard about, but when you're in the profession of allied health, that's what it's about, isn't it? I mean, that's really that's why you guys got into this, right?
I mean,
right. When you graduate from a allied health profession, I mean, we take that oath that no matter what, no matter when, no matter how, we are always going to take care of patients.
Janae?
And no, I totally agree with what she said. I mean, we got into this because we care for other people. That was the whole reason, you know, everybody gets into healthcare is because you care about others. And like I said, you just felt a sense of obligation, you know, to as a licensed healthcare provider, that we needed to be there. We needed to help in any way we could. So.
Okay. Well, guys, I really appreciate you taking the time. I think that it's important that the community knows the help that you guys give, the volunteer that you give back. It's not just about, you know, paying job over at the college. It's about like giving back and helping everything out. So guys, thanks a lot. We really appreciate you taking the time. I hope that the community appreciates this and also are enlightened a little bit about the disease and such. And thank you so much.
Thank you, Phil.
Thank you.